Emma Robson from Aspen Coaching, and today I'm here at Whole Health Physio with physiotherapist Scott Murray, and we wanted to have a conversation around pain, rehab, and I guess common narratives that people hold about what they should do when they, incur an injury or things like this. Yep. So, I guess we'll just kick so the outcome of this conversation is mainly because on my side of things, I'm a movement coach and I work with people on their movement capacity. And obviously Scott's a physiotherapist, and some people may or may not know what a physio does, and also may or may not know what a movement coach does. But it's more than just like getting a workout in an exercise for the sake of exercise. We're both trying to re-educate people on how they use their body and what their body is, I guess, designed for and capable of. And over the years, I guess we've worked together for 10 or 12 years now, maybe?
Yeah, about a decade.
Yeah, referring clients back and forth as well. I've been a patient of Scott's, and Scott's been doing some movement coaching with us over the years. So we kind of have good insight into each other's practices, and then working collaboratively with clients on their care plans to get them out of pain and back into full kind of movement capacity. So we've seen some of the beliefs people maybe have that do inhibit their healing process or them actually achieving the outcomes that they're looking for. And the point of this conversation is to try and shine a little bit of light onto some of these ideas that you may have, and hopefully empower you to feel more encouraged to do what's needed to get healthy and move well.
Sounds good.
Cool. So I guess one of the things that first comes to mind with people in pain, like low back pain is a really common one, and really misunderstood, I believe. And the first thing that comes to mind, I guess, when I see a new person who says, I have back pain, is they usually say, I just need to strengthen my core.
It's a very common phrase that I hear as well.
Yeah?
Yeah. And I think that goes back to the late 90s even, where there was a lot of research being done on low back pain back then. Quite a large chunk was in Australia. And there was a real focus on trying to link low back pain with weak core muscles. And the research back then was fairly convincing that if you had a weak core, you were more predisposed to getting low back pain, and if you had low back pain, strengthening your core may be just what you need. Mm-hmm. The research hung around for probably close to a decade, really. It was sort of 2006-ish when studies started to arise suggesting maybe that wasn't the case. But by that time, the fitness industry had latched on to this notion of core stability. It's great for business if you can get people into your gym working on their abs and saying it's going to fix your back pain. And it was also something that was quite easy for physios, I think, to latch on to and understand, or at least to try and understand low back pain, because if we had someone with a sore back that had pain that was hanging around for a while, we would often just say, well, you need to do more core work, and whether that be ab work in the gym, or what became quite popular around them was Pilates. And so for many, many years, even after some of the research was suggesting otherwise, the notion of core stability stuck around. And to this day, you still see some physios, not many in Australia, but some physios still preaching about getting your core strong to fix your back. But most of the physios from Australia and countries like England, etc., have dropped that idea that everybody with a sore back needs to have a strong core. It's not that having a strong core is bad. I mean, there's lots of training I've done in Aspen that gives you really good, strong core muscles. Side abdominals, front abdominals, muscles around the trunk, basically. So, if you're doing sports like Brazilian Jiu-Jitsu, rugby, it would be very helpful to have some abdominal strength around there if you're tackling people and wrestling with people. But the idea that it needs to be switched on and stay switched on, and that you need to remain really tense around here, generally isn't very helpful for those with low back pain. Both in the acute low back pain patients I see, but also, probably more importantly, to not go down that path if they've got chronic or long-lasting pain.
Yeah.
A lot of people with chronic low back pain, so chronic is 3 months or more of pain, will find that they naturally tense up, and they may have trouble actually letting go of their muscles.
And that's what we kind of refer to as like guarding or protective, bracing.
Yeah, absolutely. And that's great if you've got a sore back and it's been sore for a couple of days. I mean, I had some very acute back pain 6 months ago. I could hardly move off the couch, and so having a little bit of bracing and guarding in those first few days was quite useful because it enabled me to move. But certainly it was something I was trying to drop as quickly as possible.
So
as the days went by.
Is that what you refer to as when a pattern is like an adaptive movement pattern to help us, and then it turns into more a maladaptive pattern, which is...
Yeah, when it hangs around. So if many weeks down the track someone's still really guarded and bracing and not wanting to bend their spine, when in fact they possibly could bend comfortably, we'd say that's maladaptive.
Yeah.
And it was initially adaptive, but it becomes a problem when it hangs around.
And that process of like being in acute pain, I guess what I see as well as that acute phase is actually quite small, but people maintain that behavioural modification for a really long time. Like even if their behaviours change for 2 weeks or 4 weeks or 6 weeks, we're starting to get into territory where, okay, now we're just creating
bad habits, which can last
more,
for years.
Yeah, more problems. And that fear of moving, like that lockdown of not wanting to get hurt again, and which, you know, can impact us 10, 20, 30 years on, we see.
Yeah, I mean, I always try and get people moving as quickly as possible with low back pain. There's a few corny catchphrases going around, such as motion is lotion and movement is medicine, and those sayings do apply to acute low back pain. But sometimes when it's really sore, a little bit less movement for a day or two might be needed. But then you want to get that person moving in some way, whether it's a walk around the block or a cat-cow stretch or something needs to be done to move them. So as quickly as possible, you want to try and get them moving safely in ways that don't stir up their back pain too much. And we know that about 90% of people with acute low back pain are a lot better after about 2 weeks. So they're either completely better or they're virtually there. Average case of back pain may last from between 4 to 6 weeks, but that number is skewed because some cases last for many months and become chronic, and some unfortunately last for many years. And I think that initial management in the acute phase is really important to prevent the person ending up with the chronic pain situation.
Yeah.
It's managed well early on, and they get moving early on, and they get good advice that's not based on a lot of the myths that are out there, then they should get better pretty quickly.
Yeah, and the trust and that can come from the communication in those early days, or when pain is really heightened. I see having a huge impact down the track as to like the story they hold on to about their body and how they move, and the language we use in these sessions. Well,
I think the language is really important. There's a bit of a negative connotation, I suppose, with something like a disc injury. You know, people might say, "Oh, I've been told I've got a slip disc," and that language is pretty scary. I mean, first of all, discs don't slip, so it's really incorrect to say that, not to diagnose someone as having a slip disc. Just terrifies them unnecessarily. But also, disc injuries can just be relatively minor. You might just strain the disc a little bit. It might be better in a few weeks. But if someone gets told that, "Oh, well, you've slipped your disc," or you've done a disc injury, for them it can be, "Wow, I've got a really serious injury going on here. I'm going to brace much more than I need to." And often many months down the track they're still suffering, when in fact if it was reworded, I'll often say you've strained your low back, or you've sprained a disc or something, if I'm going to use the term disc. And I try and fill them with as much optimism and reassurance as I can, get them moving as comfortably as I can, as quickly as I can.
Yeah, I guess it's very easy for things to be misinterpreted, as in like a therapist telling you to take it easy and rest is not sit on the couch and do nothing for 6 weeks. And how, I might take that information and how someone else might take it is obviously very, very different. And I guess with the appointments, like typically, like I know you're not like this, your appointments are 45 minutes usually, and you run over for a lot of people, which is...
I try and do an hour or more for every initial, and then certainly half an hour or more for every follow-up.
Like having that time to listen, to hear the person, and to have like this great conversation around their situation, and to help them understand it, because it's not that they're naive when they're walking out of there and literally taking that advice and sitting on the couch. They're trying to do the right thing, and this is, I guess, what I see a lot of is people are always trying to do the right thing. No one wants to make their injuries worse.
No, that's right.
But the interpretation of the advice is sometimes there wasn't the time taken to really like harness, I guess, the message.
I mean, even if a practitioner involved, whether it's a physio, osteo, GP or chiro, is delivering the advice, if they perhaps don't have the time to really make the patient clearly understand what they need to be doing and what the plan is for moving forward. It might be easy just to say, look, just take it easy, rest it, take some drugs and you should be okay. That's not very useful advice for most people. They could take it as, perhaps I should go and lay in bed for 2 weeks and take really strong painkillers. When in fact, maybe that practitioner was suggesting they just slow down a bit, take it a little bit easier, and if there's any medications needed, take them pretty sparingly.
And knowing that it's like case by case, obviously, you know, if that was the treatment given once, you fast forward a year, if that person experiences the same pain, maybe instead of coming back for an appointment, they just, sit on the couch and take my medicine again, but never really get to the root cause of why that pain was occurring, or like what are the overhaul, like the lifestyle factors contributing to this reoccurrence of pain.
Yeah.
We kind of just put that band-aid on, settle it down, and then wait for it to pop its head up again.
Yeah, I think digging a bit deeper into why that person continues to get pain that re-emerges is important, and it's often non-mechanical features that we're looking for. It doesn't have to be, they just picked up a heavy sack of potatoes again, they were doomed and therefore they got their back pain. If you dig a bit deeper, sometimes you realise that they're going through a very stressful time. Perhaps they're working through a divorce, perhaps they're not sleeping very much, perhaps work's stressing them out and they're doing long hours, maybe their nutrition's gone down the gurgler a bit, they're eating lots of inflammatory foods and drinking alcohol. And all of those things can have a predisposing effect on producing low back pain. And if you pick out some of those things and say, well, let's try and change those things in your lifestyle, and in your life, perhaps the low back pain is less likely to come back again and again.
Yeah. I guess they're things that you and I might take for granted a little bit, as like, you know, of course we know lifestyle factors contribute to our pain and our experience of our body and our stress levels, but not everybody has that knowledge of their body. So it can seem a little bit left of field when they come in saying, I have low back pain, and you're telling them to eat a different type of food, and they're going, how are these two things connected?
You do get a few raised eyebrows sometimes. Like I had a patient this morning, a new patient, and he's a good friend of mine actually, and I had to, he had acute low back pain, began a few days ago, and I didn't want to spend too much time on stress and that sort of thing, but I did want to ask that question, has stress been higher of late? And it turns out that, he's going through a really stressful time at work and working long hours, and so that was a useful question for me to ask, because in his case there was no mechanism of injury. He didn't bend over and pick something up and felt his back go. It was probably the fact that he's been sleeping a lot less, working a lot harder, a lot more stressed than usual, and it didn't take much at all to then trigger a back pain. Yeah. So, the questioning is important, to head down that path, whether it's you or me or another practitioner talking to the client or patient. But sometimes a patient can take that the wrong way. Yeah. What are you asking me questions about my diet for? Yeah. I'm here to get my back rubbed or whatever they're expecting from a physio consult. But I think they're valid questions to ask. Yeah.
So how much of your sessions would be like hands-on physical treatment on a table versus exercise versus talking? Like, how do you...
Yeah, on the initial consult, I always want to give the patient some sense of being treated. So we have an hour for every initial consult. It depends on the complexity of their presentation, but if it's a really complex case where they've had pain for a long time, so it's become chronic, we might talk for 45 minutes, and then we might do more talking on the next session. But it could be a 45-minute conversation we have. I then want to start doing some physical assessment. That might be looking at how they move. It might be poking around on their back a little bit to work out what's sensitive. And that may take 10 to 15 minutes. And I'd never like the patient to leave without either having something that they can work on, also a clear understanding of what I think is going on, but at least something to take home. It might be an exercise, it might be some postural advice, maybe that I have spent a bit of time doing some hands-on therapy if I think it's indicated. There might be some tape applied, but they want to leave the consult at least thinking, well, at least he's done something. If it's not particularly complex, perhaps the second session is the usual half-hour follow-up. There may be some more questioning if needed, but on that session then it would be probably more a case of doing more treatment rather than assessing. And it would vary from person to person. I'm pretty exercise focused on lots of my treatment. I have a gym built into my clinic, so often I'll pop around the corner to the gym with the patient and do some exercise in there. The exercise may involve stretching, it might be some strengthening work, it might be getting them on the treadmill, for example, exercise bike. I've got a variety of bits of equipment. But I'm also a physiotherapist trained in manual therapy, so particularly on the acute cases, if they've got some back spasm or if they've got something that needs some tape applied, or something that I need to loosen up, then we may spend some time in this room with a treatment table and do some hands-on. But you find as time goes on, they need less and less of the hands-on, and you're really trying to empower the patient to, it sounds crazy from a business point of view, but you really do want to empower them to not have to come back and see you all the time.
Yeah.
I think that's what a lot of physios are doing nowadays, is saying, look, we'll do our bit in the short term, but long term you don't need to be coming back here all the time because you've got X, Y and Z that you can do to keep it at bay.
So that idea, like we're a product of our environment, right? Like human bodies are complex, we live in complex worlds, we're interacting with lots of different things both in our body and outside of our body. And so what we are experiencing is like, it's coming from something in our lifestyle.
Mm-hmm.
So then when we come to an appointment and expect in that session for it to be fixed or removed just like that, it doesn't make any sense. So that conversation around the bigger lifestyle factors and how are we moving about our day, how are we dealing with stress, how are we eating, etc., all plays into care, right? And the way we move, or the variety of movements we have in a day, being more important than like getting any one movement right. Mm-hmm. And that makes me think of posture, right? Like how many times we've been told what the perfect posture is, but we know there is no perfect posture, or maybe some people don't. I don't know.
No, there's a big difference in the way that I've approached posture in the last few years, because when I was trained a long time ago, 25 years ago, we were really telling people to sit up straight, don't slouch. Slouching was bad for your back. As you can see, I've been slouching for a while now in this chair, and I'm pretty comfortable. So my advice nowadays for someone in relation to posture would be to change your posture as often as you can throughout the day, if you want to avoid getting stiff. And it works well for back pain especially. People often sit down at their desk for 8, 9, 10 hours, often don't move very much at all. They might have their lunch at the desk, they might pop up once or twice to go to the loo, but it's pretty common that I hear people saying, well, I sit down for 8 or 9 or 10 hours and I don't move much. Yeah. So my advice to them is get moving, and we have another corny catchphrase, which is your best posture is your next posture. And when that information is planted in their head, they do get the message often, but they need to wriggle around a bit more and try and adopt different postures. And that might be slouching a bit, it might be standing up from time to time, it might be sitting up straight from time to time, it might be leaning forwards or off to the left. And
I think that's the other part. It doesn't need to be like a big amount of movement. It's not like jump up and down and do some burpees and push-ups. Like that's not it at all. It's like just shifting in the seat or changing the way the pelvis is sitting, or you're just moving from one comfortable posture to another. Like if I've had some low back pain, as I mentioned, in recent months. It's pretty good at the moment. But if for some reason it was getting stirred up by this slouchy posture I'm in, then I would find myself after a while saying, well, that's getting sore. Perhaps I'll sit up straight for a while. My pain's gone. Yeah. And maybe I'll last 10 or 15, 20 minutes in that position. And then if it was getting sore again, I might go back to a more comfortable posture, or I might lean forwards and stand up, have a walk around, whatever it may be. Yeah. But I think if you can get patients to move around a bit more, both in sitting and also getting out of the chair, they'll suffer less with things like low back pain. One of the things I've seen, like with people in their movement training, for example, is maybe they have a tightness in, they don't rotate very much through their thoracic, or they don't have any extension in their thoracic spine, or whatever that immobility is, but they bring that with them into every single exercise. It doesn't matter what they're doing, they're still kind of in that flex state, and so just shining a light on sometimes like a small little shift in, or bringing awareness to like actually that muscle, that area could sit slightly differently, and now let's just go do all your normal stuff with this slight micro adjustment, can be enough to like start facilitating change. And
absolutely. I see that in low back pain especially, that people don't want to bend it. They've got this idea in their head that bending forwards, especially under load, is very bad for your low back. And it was actually probably really reinforced how silly that idea was when I started training in Aspen and I was introduced to Jefferson curls, which initially I thought, oh, this is interesting. I've got a weight in my hand and I'm bending forwards with a really bent spine, but it feels so good. And it was around that time too, the research, a lot of it coming out of Curtin, with some great academics up there, were showing that we can bend forwards with a load and have a safe spine in many cases. There are some patients who perhaps have a nasty disc protrusion with sciatica, who I'd say at the moment,
back off.
But don't do a Jefferson curl with a heavy load, But for the vast majority of people, especially those that have had back pain that perhaps don't now, who aren't comfortable bending forwards, Jefferson curls are an ideal exercise to train that person to bend multiple segments of their back. perhaps they've been guarding and keeping straight for a long time.
And it's one of those movements, like you can't brush your teeth in the morning without bending forward to the sink. You can't tie your shoelaces up, you can't hop into your car, you can't pack your dishwasher if it's down low. Like, there is so many normal day-to-day actions that people are probably already doing that involve that forward flexion, but then in a gym setting are very guarded, and actually kind of showing like it's a very functional movement that we do need in our day-to-day. It's incredibly important so that we have this ease.
Yeah. I think gyms are renowned for very linear movements and keeping the back nice and straight, and often the advice would be, you know, keep your tummy muscles nice and tight. And okay, that might be fine if you want to get certain bits strong, but if you then take that out of the gym and you do the same things and you keep your tummy muscles tight and you don't bend your back, it's not very helpful. You know? And the moment you do start to pick something up with a bent spine, if you're not trained in doing that, because you haven't been doing other forms of bent back training, then you'd be at more risk of back injury more than likely.
So with the same kind of thinking, like, you know, if we have back pain then we want core stability, that was like, say, what we've just been discussing. The next one I think of is like, my knee hurts, you just need stronger glutes. Or, you know, shoulder and neck pain, oh, you just need more shoulder stability exercises. It's the same sort of approach. Has it been the same sort of narrative in the past, and do you see it changing in those other areas of the body too? Like, pain doesn't just mean we need more stability or we need more strength.
So, I mean, it's a good question, I mean, it definitely applies to the low back, and there's probably less research in examining those other areas, but I think, you know, every patient's going to be different, and strength is often very helpful if someone is really atrophied and weak in a muscle group, which happens commonly around injured parts. You know, if you have arthritis of your knee, often you'll see neglect of those quad muscles, and so working on them does help. Shoulders too, you might find there's weak muscles around the shoulder that strengthening those will help. But there's a bit more to it than just that. You know, if you're only given a strength program and you're not focusing on getting smoother movement or more coordinated movement through that region, or loosening up tight muscles, then you're kind of missing, I think, part of the puzzle.
Yes, I can picture a few people in the past who have done their rehab exercises like perfectly day in, day out, but, you know, fast forward 18 months, they're still like, I've got to do my rehab. Because, you know, I'm like, well, if you've been doing it for 18 months, surely it's like got to work by now, right? And they can get stuck in that, you know, just doing all your rotator cuff exercises for 45 minutes before doing anything. And then, like, you get really good at doing your rotator cuff exercises, but you haven't really harnessed or learned how to move your shoulder differently, or, like you said, that control and coordination of movement.
There might be a few weeks or months where some of those exercises are relevant, but in that far down the track, there's much better stuff you could be focusing on.
I think it's like that graded approach, like you know, when you're in acute pain, there are things that we do to modify behaviour, like the reducing movement and bracing, etc. But that is short term, and it's, you know, hopefully a couple of days. And then knowing that it's going to move into like a rehabilitative strength building, awareness building, proprioceptive building kind of phase, and then there's still more steps, but people often just stop at the beginning and don't have these long-term relationships that kind of evolve over time. And
well, they often stop when there's no pain, you know.
That's
so
true.
I'll see it multiple times when the patient goes, right, my back pain's gone, thanks very much, see you next time. And you know, and for some people that's fine. It's you know, it was their only episode of back pain, and they're a young, healthy person that is doing most things right, lifestyle-wise. So I'll say goodbye. But other people who perhaps have more recurrent episodes of back pain, would then be a good time to say, well, hang on, we've got a little bit more work to do if you don't want this to be a problem in the next few weeks. And some people are okay with that, and they go, that's a good idea. I'd like to continue with a bit more rehab as a preventative approach. And others do want to call it quits the moment the pain's gone. Yeah,
I guess that's where what we see more of is once they're out of pain, they kind of working with us and doing movement training. And
that's where I'm often likely to refer someone on to a place like Aspen, where I can say, right, well, you know, you've done a lot of hard work, you're out of pain, you're moving pretty well, you've got a decent level of strength back. The question I often get asked is, well, how do I prevent future injuries? And it's training like you do at Aspen that I think ticks a lot of boxes, from balance to proprioception to coordination, strength, power, mobility. You know, lots of boxes being ticked. Rather than just go to the gym and do some bicep curls and deadlifts.
And how important is it to get a clear diagnosis of what is going on?
Not that important for some injuries. So, we do our best to diagnose what's going on with a particular patient. So if somebody comes in with a sore back, there's a very thorough assessment, both in the what we call the subjective assessment, which is me asking lots of questions and listening to their story. There's also a pretty thorough physical or objective assessment where we're looking at things like ranges of motion and strength and maybe some neurological testing. And then we do our best to try and formulate a diagnosis as specific as can be, and then a treatment plan from there. But the problem with low back pain especially, and other body parts we're finding out as well, is that often the pain is non-specific. So let's say about 95% of low back pain is non-specific, which means we can't say for certain that it's that particular thing in your back causing you pain. So if we then recognise that 95% is non-specific, we don't really need a super accurate diagnosis. We just need to say, hey, you've got non-specific low back pain, although it's not really a common phrase I tell the patient because it's a bit annoying for the patient to hear that. They think you don't know what you're talking about. But in the back of my mind, I'm thinking they have non-specific low back pain, which means we've ruled out the really nasty stuff like a cancer on the spine or a broken bone or something. And if it's non-specific, we can then start tackling some of those factors, such as the lifestyle factors or psychosocial factors. If they need some manual therapy, we apply that. We certainly give them some exercises in most cases. So you don't really need a very specific diagnosis in something like low back pain to move forward, because at the end of the day, if you address what you picked up in the assessment, it's going to get better and they're going to feel better and make a recovery. There are some things that you do want a very accurate diagnosis of. If you suspect that, for instance, someone has cancer growing on their spine or somewhere else, you can pick up maybe that there's something a bit fishy going on by some of the questions you ask, and then you might refer that person on to a doctor or to get scans. And in that case, you would like to know specifically what is the diagnosis and is there anything that we're not doing in physiotherapy that needs to be done?
Yeah. And that initially just comes from that conversation, those questions, listening to someone, and then with your knowledge being able to siphon through some of the answers they're giving about their pain and their experiences, and then you can...
Absolutely. I mean, with low back pain, there's a lot of non-specific diagnosis. In other body parts, if I'm talking about, say, someone's Achilles region in their ankle, we kind of want to get a pretty good idea that we're dealing with an Achilles tendinopathy rather than a torn Achilles tendon or something, or a plantar fasciitis a bit lower down. Like, you do want to have a much clearer idea of the diagnosis. Yeah. But in some cases, like often knee pains and shoulder pains, particularly when they're a bit more chronic, the diagnosis is less obvious and it's less specific. And
then this would lead me into like scans and their accuracy of like when to use them and when to avoid them. Avoid might be the wrong word here, but there's a lot of emphasis put on what a scan tells us. Like, just get a scan to find out so I can know exactly what's going on. I just want to do the right thing right away. Yeah. And we're getting a lot better now, at least in the physio world, at not rushing everyone off for scans. You do still see some practitioners, part of the business model is to say, right, you come into the clinic, we're doing an X-ray. If you've got back pain, everybody gets an X-ray. Does everyone need an X-ray? Absolutely not. It's radiation that we probably don't need. B, it often doesn't change the treatment plan at all, or it shouldn't do. It's a good idea to do a scan if you suspect what we call a red flag. So if I thought someone had a broken bone in there, let's talk about backs again, but perhaps I suspected a fracture or broken bone in the spine, scan's a very good idea. If I thought that they had a really nasty disc protrusion pushing against the nerve, a scan might be something that we head to pretty quickly. Cancer, of course, you want to be ruling out nice and quick. So there's definitely a time and a place for scans. But once again, about 95% of backs that come into a clinic generally don't need to get any sort of scan, because it doesn't really help us get that patient better faster. In fact, some of the studies that have been done have shown that you get better a bit slower if you have a scan, because if you scan someone who's in their 30s, 40s and onwards, you're pretty much always going to find, if we talk about spines again, some degeneration, some form of arthritis brewing, degeneration, etc., of discs, of joints, disc bulges. These things are all very normal in people that have no symptoms. And if you do a scan and point out to that patient that they've got all these things wrong with their back, it slows their recovery down, because they start to get concerned and maybe brace and maybe don't get back to sport when they should do. And
get the population of people that don't get a scan and just get on with it and get some good advice and a fairly active approach to treatment, they get better nice and quick.
Yes, I can picture this with a recent, I say recent, it was a good year ago now,
Mm-hmm.
but a client who had his shoulder scanned because he'd had a terrible accident
Mm-hmm.
and had to have surgery, so he had a lot of scans around that. But then the scan showed up something that he didn't know about or in another area, and then that all of a sudden became like something on his radar. And I remember saying to him, like, do you have any pain, or like, have you ever noticed it before? And never noticed it, had full function, lived a very active life, but since he like found out on paper that there was something there, all of a sudden there was a lot more fear and guarding around his movement. And
you know, I mean, I mentioned my back pain before, and I did 3 months before my low back pain began. I had some neck pain, and both have led to some nerve pain, which I've now recovered from. But I had scans for both because there was some quite concerning nerve involvement. My muscles were going weak in my arm at least. So I think the scans were justified then, but getting those scans and seeing those disc protrusions did mess with my head a bit. Even as a physio, when I kept telling myself, don't worry about them. They're not that, it's not that concerning, it's a disc protrusion, but you can still function normally and have a normal life, and the pain should go away. But even knowing that, it was still messing on or playing with my mind a bit. And I don't know if I'll ever forget the pictures that I've seen of my neck and my back. So for many patients, it's better not to head down the scan path if the red flags have been ruled out. Because those pictures can be quite damaging for some patients.
And like you said, the treatment is still the same. We still want to
Still
have
the same treatment.
quality of movement, de-stress, a lifestyle that's not super conducive of high stress and inflammation and things like this. So
that's right. Eat well, sleep well.
Yeah,
I mean, you're
all the basic pillars that I know can be frustrating to hear when you're in like a state of pain, because you want something more specific and more.
Well, at the end of the day, people
unique.
want to get better faster, and you'll accelerate your healing with good sleep, good nutrition, appropriate movement, keeping stress low. They are the 4 basic pillars that often come back to the patients.
Yeah, and I know when I did my ACL, I was 7 weeks pregnant, and when I tore my ACL, and that was the first thing I thought. I was like, right, okay, diet, lifestyle, sleep. What can I maximise on here to try and. I can't do much with my knee just yet, like while I was trying to figure out what was going on, and didn't want to rush any of the kind of physical exercise side of things, and that just became my focus. It was just good nutrition. And
some of those things you can control. Those things you can control more or less. How many hours sleep a night you get. Some people have trouble, but
have babies.
If you have babies, it's a different story. But you can have a good bedtime routine. You can certainly control what you eat. You can control what you drink, alcohol-wise. So there are things that you can control and modify. And I do often get patients really focusing on those, because the actual tissue healing is often beyond their control. But some of those things being adjusted will improve tissue healing rates.
Yeah. Anything else?
We talked about lifting, didn't we? Sort of Jefferson curls and lifting, posture, core. I'll just do a quick pause there. Do you want to have a check the phone? What was on your message? Anything else that we missed?
Language, narratives, posture, just the body being complex, lifestyle focus, I think we did.
I've got a little cup analogy. Did I ever speak to you about the cup analogy that I use? I know you guys have some awesome analogies too that you use, but I'll do it with every sort of semi-complex patient, just talking about those lifestyle factors going into the cup, and when the cup gets full, pain emerges, and often that's a bit of an aha moment. They go, oh, okay, that kind of makes sense. When you were telling me about stress and sleep before, didn't make sense, but do you want me to go through that? I mean, I can, and if you don't like it, you can just delete it, of course.
I know that.
I have got a little whiteboardy thing.
Right, so I'll start with
So you might say, so have you got any ways that you can help explain to patients the importance of lifestyle or psychosocial factors?
So in regards to pain, when people are in pain, what do you tell people in regards to lifestyle, psychosocial, like all the other stuff other than the tissue and the muscle?
Yeah, well, I mean, the tissue is often part of the issue, but there's often a lot of other stuff that we need to tackle to help the patient recover from the pain that they're in. And it becomes a bit more important when the pain is longer lasting, so when it's into that sort of chronic pain state, which is, as I said before, 3 months or more, then those other factors become a little bit more important to address, I find. Something I often use, I can show you on the whiteboard here, is a thing called the cup analogy that I didn't come up with, but a very famous physio in Canada did. And I use it a lot, and it's a really nice, easy way of explaining to patients how some of those factors that they may not have linked with their pain can be part of the cause of what they're going through. Perhaps if I face the camera and draw on here. So if we look at the body as a cup, I just tend to draw a big cup on there, and when the cup gets full, pain emerges or a pain flare occurs. Okay, so the first question you ask the patient, or the patient should be asking themselves, is what fills their cup? And often there's a little bit of stuff like structural change. It might be some degeneration of a disc or a prolapse disc or something, but we can say, very hard to write sideways here, that structure isn't everything that's causing their pain, but it's part of the problem. It might be that I ask them questions around sleep and they say, you know what, I don't really focus on getting good sleep. I'll sleep for 4 or 5 hours a night, and I might flag that as something that's relevant. Now you can see none of these things have filled the cup yet, so we can't blame their pain on just their degenerate disc or the fact that they're sleeping 4 or 5 hours a night, but the things that are filling up the cup. I might ask them some basic questions around nutrition. I've got to be a little bit careful when I start asking around things like sleep and diet and that sort of thing, because I'm not a dietitian, I'm not a sleep expert, I'm not a psychologist, so the question they ask, they don't get too deep really, and they're just more for me to gather information. But it might be that they're eating lots of processed foods, so I might say, okay, well, potentially there's some inflammatory effect from the diet that you're consuming. It might be that they don't like their job, and they're having some trouble at work, they didn't get the promotion they wanted, it's causing a bit of stress, but they're also having a few troubles at home. One of the kids has left home recently a bit prematurely, and they're having some dramas with their spouse. So these things are causing some stress in their life. Then all of a sudden you can see the cup starts to fill. If we're at the top now, maybe that's enough to cause the back pain or the neck pain to emerge. So part of it's structural, part of it was sleep, part of it was diet, work, home. Other factors might be smoking, it might be drinking lots of alcohol, it might be a lack of exercise, that's of course a big one, but there's lots of factors that can fill up the cup. So the first thing you then ask the patient is, well, can you put less stuff in the cup? And sometimes it's possible, sometimes you can put a bit less stress into your cup, maybe you put a bit less processed food into your cup, but some of those things aren't really modifiable as well. You can't really change the disc degeneration that's happened to your disc in your low back. So the smarter way of looking at this, and this is what Greg Lehman, the physio from Canada, suggests, is think about building a bigger cup. So of course with a bigger cup, then the stuff that's going into the cup doesn't fill it up. It takes a lot more content to cause an overflow, and with those things we discussed. Well, building a bigger cup is building a more resilient mind and body. So it's doing that exercise, building a stronger body, maybe working on mobility. If the mental stuff is an issue, perhaps practicing meditation or getting out into the countryside for some hikes on a weekend. And if you make your mind and body more resilient, we could say that your cup is bigger, and then the things that are going into the cup don't cause the pain flare. And it's often around that time the patients start to understand why you've been talking about the other things that they think or perhaps thought weren't so important.
Yeah.
Sometimes people still don't really get it, and they don't really understand where I'm coming from, but it's often very useful.
Resilience is not about everything always being smooth sailing, it's being able to deal with the troubles when they come and come out the other side of them.
Exactly.
As little damage as possible. It's not about not weathering a storm, but how well can we get through it?
And it's very uncommon that people get through their whole life without pain, and an injury. I think we have to accept that a lot of the time pain and injury will be part of just being a human. But if you try and make your body as resilient as possible, and mind as well in many cases, you know, there'll be perhaps less injuries, and when you do get injured, you'll recover a bit quicker.
Yeah. And I mean, these things are best tackled when we're not in a state of crisis.
Yes.
But often they're brought to our attention when we're in a state of crisis, and it's the hardest point for us to change because we feel really overwhelmed and stuck.
Yeah.
But if we can address these things when life is kind of good and we're preempting, like, okay, let me be as strong and as capable and as mobile and as resilient as I can, so that if and when challenges come my way, I can take good care of myself. I guess that's that like longevity approach to why we move our body.
And that's probably the difference in the people that I see versus the people that you see. Like, often I don't get those people coming in saying, hey, I'm at physio now, I've got nothing wrong with me.
Yeah.
Let's have a consult. It'd be lovely if they did,
Yeah.
and I could help them perhaps, work on some bulletproofing. But a lot of the time they're coming in with pain and suffering, and we've got to get them out of that as quickly as possible.
Yeah.
But with you, I think people are often
Yeah.
coming and saying, hey, I feel pretty good. How do you make me feel even better?
Yeah.
And then of course you get some coming with pain, because I know you guys do a great job with helping people in pain as well.
Yeah. How interesting.
I can think of a lady I saw a few months ago now that, she had some low back pain. She'd had it for years and years. It was about 7 years or so, and her scans weren't too bad at all. She was in her mid-60s. The scans were looking pretty healthy. She tried lots of different interventions, lots of massage and physio, but I don't think anyone had really probed into the lifestyle factors too much. And it turns out she had a job that she wasn't particularly enthusiastic about. It was a desk job, 9 hours a day. She didn't really move out of the chair. She ate her lunch in the chair, she'd sit down all day, she'd drive for an hour to work, an hour home, so 9 hours plus 2 hours driving, 11 hours. Would get home, be pretty sedentary, did virtually no exercise apart from occasionally walk the dog on the weekend. And so asking a few more questions, I realised that one of the reasons that she's got this chronic low back pain that's emerged may be that there's just not enough movement in her day. She's not wriggling in her chair, she's not changing postures, she's not exercising at all, basically. So my main intervention with her was just to really try and convince her to get a bit more active. I said, look, can we just set a goal where you go for 10 minutes, a 10-minute walk on your lunch break? You've got an hour off for lunch, I want you to walk for 10 minutes every day. And I think initially she thought that was a strange idea. She probably wanted her back rubbed and some hands-on techniques done. But we started with that, and it seemed to be working, because quite quickly, within a couple of weeks, her pain was dropping rapidly. And within sort of 4 to 6 weeks, she'd lost virtually all of her back pain for the first time in 7 years. And it wasn't that I had performed some magic technique or anything. It was just making her understand the importance of movement.
Yeah.
And it was about behaviour change, really. It was getting her to change the behaviour that she had done for 7 years and see the value in moving, and even just a short dose of exercise. It then went from 10 minutes to 15 to 20 to 30, and I don't see her anymore because she doesn't need physio, but last I heard she was exercising for half an hour every day on her lunch break, and it was just keeping the pain at bay. But it was a perfect example of how it wasn't a structural pain that was driving her 7 years of, a structural reason driving her 7 years of pain. It was just a lifestyle factor, being too inactive and not valuing movement. Yeah.
Great, good job for inspiring her.
I was happy I could help her.
Awesome. I think that's all I've got today. If this conversation does or has spurred on any questions that you would like answered, by all means reach out to us at Aspen, or you can contact Scott directly at Whole Health Physio. We both clearly love talking about this sort of thing. So by all means reach out with any specific questions. I will put below contact details for Scott if anyone is interested in reaching out further or directly to him. And otherwise, thanks for your time.
Thank you. Could we run a tiny bit, perhaps on me just asking you a question or two?
I'll just do it all in one. Sorry.
I never really thought about what to ask you, but so I can direct people towards Aspen and that sort of stuff. So maybe if I ask you about what you guys do, what the movement approach is all about, and what you've got available at the moment, because I think Glenn's people done. You've got the online program. So just some basics about Aspen, and at some stage I can be throwing that on social media too.
Yeah, okay.
And also, I can just have little snippets that if anyone asks, I can say, hey, let me send you this video about Emma talking about Aspen. So Emma, over the years I've sent many people towards Aspen, and I've always appreciated the input that you guys give and the sound advice delivered to the patients of mine who've become clients of yours. What would be the summary of what you guys do? Like, what's the best way to summarise what Aspen does as far as your approaches?
So I guess we take a movement approach rather than just like an exercise or a fitness approach would be how I would summarise it in a nutshell.
Yep.
And then that, I guess, starts to say, well, okay, what is a movement approach? Movement is everything. It's looking at how our bodies move, from how we walk, stand, sit, crawl, breathe, eat, just how we function, how we do our Pilates, how we do our yoga, whatever it is that we choose to do. It's kind of taking a lens and looking at how are we doing that. And I guess over the years we've kind of identified like 5 qualities of movement that are really crucial to like a well-structured human being. And that is learning how to have like grounded and strong feet. So they're like the bottom, the foundation of our whole body, and really crucial in how the rest of our bones and therefore muscles kind of stack, whenever we're doing anything up on 2 feet, which is most of our life, right? Walking to work and engaging and playing sports, it's all dependent on how strong and how grounded our feet are. And then the second quality being like having bouncy legs. So legs that it doesn't need to be like, you don't need to have the splits and have all this amazing range of motion or be able to squat crazy amounts with a barbell. But you want your legs to be like this spring, so that your feet and your legs can spring and bounce and give you this spring in your step.
Right.
Mobile hips would be the next thing we focus on, which is, again, not having extreme ranges of motion, but having that femur actually move in its hip socket so that the lower back actually stays a bit more stable and a bit more safe. So when we approach, say, lower back pain, we straight away go, okay, are the femurs doing their job? Are the hips pivoting well? Or is the back kind of taking the brunt of our rotational forces? Fluid spine is the 4th quality. So most of us, I know myself and the coaches we've worked with, we all had pretty rigid spines because for many years we've been told how important a neutral spine is and to stand up tall, and we've had this fear around spinal flexion for a long time. But actually learning to use your spine like this fluid-like structure and transmit the forces has been game-changing in unlocking like full body mobility and just this quality of softness in our movement. And then loose arms, like how many people have tight neck and shoulders? Because if the spine is kind of not doing its job right, the shoulders tend to...
You see that a lot, don't you? With the shoulders hooked up.
Yeah, really tight tender traps. When someone tries to massage you, it's really painful. So we actually, we want to create these nice, long, loose arms. And when you bring those 5 qualities together in movement, essentially like, well, one, you feel really good. 2, a lot of your injuries and pain kind of start to dissipate anyhow. But it opens the doors to what we can do with the body. It's not about being good at any one sport, but it's being like this more well-rounded.
Sounds great. I've learned lots of bits and pieces around those 5 over the years from you guys, so we'll see how it all pieces together. And you've got a online program at the moment that you've recently launched? Yeah. So we used to have Aspen Coaching, which was a physical gym in Mount Hawthorn, and we were there for 5 years. We've been operating for a lot longer than that, but we had our own space for 5 years, and we just closed down at the end of in the middle of 2023 to have our second baby. And not because we weren't in love with the work or anything like that before, but we just needed to pivot our business model, and we created an online program. We took a bit of time, first of all, to have a look at like everything we'd done with people over that 5 years in our classes and our private coaching, and really trying to have a look at the gaps of what was missing. So we spent a bit of time cultivating this program, and we created this program called Groundwork, which we are running online. And it's running online because one of the biggest missing pieces was people taking the ownership of doing the work themselves. And that's where we were seeing the most change or the most benefit, is when someone actually walks out of the gym and applies what they learn to their life. Rather than just coming to their gym session, being told what to do, being told when to be corrected or whatever, and then not applying anything as soon as they walk out the door.
So the people that did apply it and started a home practice and started to question their daily movement habits or whatever it was, got so much more results, and we really wanted to understand what that was. So thinking that that mechanism was like self-practice and self-ownership of this movement journey, we thought the online format might actually bridge that, and it has. We've just started our first round. We're only 1 month into this first 4-month program.
I've heard good things so far.
Yeah, and the results are going, like the comments people are saying are amazing, and they're only a couple of weeks in, and like I know I've worked with people for 12 months before who aren't getting the results that these people are getting in 4 weeks, because these people are having to do the work on their own at home and really question and understand their movement. So when they come to us in their private sessions, which is still online, they're coming with such great questions, and they're really understanding things like quite quickly.
Yep.
Which has been like phenomenal for me and Glenn to watch as well. So yeah, our online program kind of covers those 5.
And you'll have another one up and running in the coming months by the sounds of it, for people to engage with and sign up for.
Yeah, our goal is that eventually people can just start whenever they like and run this, but being new, we're just kind of running it in 4-month chunks. So as people sign up, we're running the group through together, and we'll probably do that again in the new year. And then I think we'll be ready to start onboarding people, and they can just start at their own pace and work with us whenever they like. Yeah.
Very good. Thanks for sharing.
Cool. Thank you.
All right, I think we got it. Do you want to just play that back and make sure we did get it?